So I am here lying on another bed to do some PRP with a wonderful woman I want to introduce you, Diana. There you are, yes, Diana, say hello. And she works with Dr. Seebeck, who I've had do my Botox since I was 75. So today I'm doing something called PRP.
Well, the proper name is platelet-rich plasma, and platelet-rich plasma consists in drawing blood, a blood sample. This is trying to use all the healing elements that your body puts in motion when you have an injury. Okay? By drawing your blood, spinning it in the centrifuge to get rid of the red blood cells by weight, we're just lowering them in the tube.
I want to ask you a few other weird things. It goes back to that philosophy, I think, Diana, that we can put endless creams on our face that can have a very short-term solution, and then we can do a bigger procedure that can have a more long-term effect. So it's, you know, when I'm weighing up that, I think of the cost of all those creams and all those facials we have versus doing this twice a year and having a long-term benefit.
A long-term benefit. The first thing they do is to clot the blood so you don't bleed, okay? Then they send out growth factors, amongst which are growth factors that are going to be increasing the vascular structure, but also bringing in new fibroblasts, which are skin cells, to heal this area by getting more collagen and elastin built up. We cheat a little bit. We put a higher concentration of platelets because I'm spinning them down, so I'm getting about 20 times what you would get with a micropuncture of your skin.
Okay.
And I'm putting those platelets back in to the skin under the surface superficially, in the area that the skin turns over much more, the superficial part, and in depth to get a little volumization in deep areas of subcutaneous volume.
I did have it done once, not by you, okay, and they used injections, and I really bruised.
Yeah, you really
under the eyes. I
yeah.
really bruised, and it wasn't very pleasant for 2 weeks.
Yeah.
So, I mean, there's two things here. So one is the downtime. So if we do it with a mesotherapy gun,
and with a mesotherapy gun, we're remaining in the superficial dermis where there are very few blood vessels.
Yeah.
So you should rarely see bleed. Okay.
So you could go out to dinner 10 minutes later.
You could go out to dinner.
Yeah. This is another little thing, because I have here a little bit of hair loss, and it's hair breakage.
Okay, this is rather typical in as women age.
Yeah.
We have what is called male pattern hair loss because as estrogen and progesterone go down, you're having a different balance in hormones, and you have more of an androgenic effect. So we call this male pattern because it's in the Gulf and it's on the top of the head.
The Gulf of Mexico.
The Gulf for these, the Gulf of Mexico.
Yeah, okay.
In men, you can really imagine the Gulf. In
Yeah.
women, you can start to divine it because it's the area that gets paler, okay? Because of the density of the hair.
Yeah.
Platelet-rich plasma has a growth factor effect on the scalp.
Okay.
So we're going to increase the vascularity of the scalp tissue
To promote the hair growth.
and we will get stimulation of hair growth, and we will get fortification. I know fortification, that's a French word turned into
Fortification.
English. Yes.
Okay, but we're going to
get
get a stronger
of the
hair.
hair that's already there.
So the breaking off bit.
And if you were losing hair, let's say now this is the time of year where we all lose a little bit of hair in the fall.
Why is this the time of year we always lose hair in the fall?
After the summer.
I never knew that.
Yeah, no, it's like leaves.
It's like leaves!
The falling leaves.
The falling leaves. Jum,
So,
jum, jum, jum.
you will notice that practically after one treatment with PRP, the hair loss stops radically. Okay.
And you do there a deep needle, or you do which is
We're
better
gonna
for
be-
it?
We're going
Or
to be deepening the gun puncture because we can regulate gun puncture to different depths. So we do it so we see a tiny bit of blood. Okay. But it should be, an appropriate amount, not too deep.
Yeah.
And then we also do individual injections throughout the scalp with the gun.
So I'm just going to show my hair loss properly here.
Yeah.
So there you can see that breaking off.
You can see that this is an area that's poor. You put a tiny bit of color there, so
I put some color. Yeah.
And it's what we tend to do is to use a little bit of color here because the area is already pale because there's less hair, and then as white hair comes in, you see like a
paler.
white area.
Yeah.
So everybody who tries to cover up and get to the next color treatment will know that they have to do these two areas.
Yeah.
Okay.
Because
And
if I
probably
didn't
along
have,
here.
just so the ladies know, I've got colour wow on that I always use a lot, which is what Diane's referring to.
Yeah.
So if I kind of take my
I can
saliva
I can take that.
and take that off, you can really see.
You'll see that it's a pale area.
Yeah, just really
Okay,
get that
because
surgical spirit
these
off.
products are
Yeah.
great, and if you take a look, we've now gotten rid of the product, and yes,
Yeah, you
it's
see
a much
that.
paler area.
Yeah,
Okay.
exactly.
A centrifuge makes things spin. We balance it has to be balanced because centrifugal force, otherwise we'll believe the machine will fall off the table. So you're going to see when I stop the spin that they are balanced symmetrically. They could have been,
Okay,
1, 2, 3,
yeah.
4. Okay, I tend to do it the quickest way. And these are what it looks
my
like.
God,
We
yes.
have separated the red blood cells, and now we have the yellow plasma, and I will show you that these tubes are filled. There's a separator gel that allows them to fall through by size. They fall below. This is a separator gel, and by weight, we know that this is the highest concentration of platelet-rich plasma. However, platelets will be all the way through here. We're going to use the platelet-rich part of it, and we're going to use the plasma as a sort of healing substance on the skin after to help all these little micropunctures heal a little faster.
Oh
Okay.
my goodness,
Yeah.
let's get to work. I mean, I think some people are a little bit nervous of something
Yeah.
so medical.
Yeah.
We're in a very medical place. But
This is one of the safest treatments you can do. It is autologous, which means it comes from you. You can't be
autologous. Autologous. What a
Yes.
great word.
Isn't that nice?
How do you spell autologous?
Oh, this is much trickier. Spelling out loud has never been my
Okay, so
forte.
autologous means that it's something you made that you're
Yeah.
putting back in yourself.
And it's going back into you. Okay, so
But is autologous just something from me, or is autologous putting something back into you that's made
it's
for
an
you?
identical. Autologous means identical substance. Okay, biologically it's identical to you. It's yours. Okay.
Okay.
So you cannot be allergic to it.
Yeah.
Okay.
Yeah.
As I told you, the mild histamine reaction is not allergy. It's an
Yeah.
irritant reaction of the white blood cells. Okay. So no long-term allergy, no short-term allergy.
Yeah.
It can't go bad in 2 months. It can't go bad in 2 years. Okay. This is your plasma going right back in. As you see, it took me 10 minutes to spin it. It's going to take me 2 minutes to prepare it, and another 5 minutes to put it back inside
Okay.
here. So we
Yes. Bet you're excited to see as I am.
advisable. And we're going to get started, okay?
Absolutely pain-free.
Yeah, there was no anesthetic cream on the skin, okay?
That's
And
fine.
as you can see, we're getting little tiny pressure on the skin as the needle goes back and forth, but there should be little or no bleeding if this is done properly, okay?
So it's actually
So we're
piercing the
doing very
skin.
superficial dermis. We're doing multiple little tiny puncture marks. And the barrel of the needle is not going totally into the skin. That's why we have some plasma remaining on the surface, and that's perfectly normal.
And then for lip lines, it's good, isn't it?
Yeah.
So pack it in there.
Yeah.
Pack it in there.
Okay. So it's normal that we have a wet skin surface, okay?
Yeah, because that's
And
the
we can
plasma just.
Yeah, and we can adjust the depth of the needle, obviously. As you see, the guard of the needle is going to be getting very close to the lashes. Now, if any plasma gets in the eye, you have to be reassured that it's actually very good for the cornea.
Great,
Okay.
let's pile it
Yes.
in. Keeps the eyesight good. That would be fantastic.
In certain countries like Germany, when they do cataract surgery or eye surgery, they also put drops of platelet-rich plasma in the eye so it
Do
heals
they?
faster. Absolutely, yeah.
God,
Platelet-rich plasma is used in many fields of medicine today to get rapid healing, less scar formation because we're getting faster healing.
Yeah.
And it's used in dentistry, it's used in orthopedics, it's used,
So if you had a
practically
bad scar
yeah.
and you healed you'd done the surgery and you think,
Yeah,
would
yeah.
you ever do this to help with the scar?
Yeah, definitely. And we will do it as soon as 3 months after. Now, some surgeon, then it's really depends on the surgeon. I will ask the patient to check with the surgeon, but I will go ahead and inject as soon as the surgeon allows it to be injected. And otherwise, I'll wait 3 months. A stem cell will turn into the cell of the area that you've, so if we put this in tendon or in cartilage, you're producing more of that type of cell. You're not producing hair cells in your knee, okay? As you can see, we have a few more marks because less density.
And there's less fat. You know, people, you always admire in somebody else things you don't have in yourself, but I always found my neck made me feel always very scrawny when I was a teenager.
Yeah.
You know, and kind of
Yeah.
this thing poked
Yeah,
out, and you wear a polo neck and it only comes halfway up your neck.
In the days you wanted to hide it, now you don't want to hide it anymore. Now it's an asset, my dear. Okay, I have a tiny bit that I'm going to keep to do the gulfs up here.
The Gulfs.
The Gulfs.
The Gulfs
okay.
of Mexico.
Yes, okay, so
There we
we come
go.
up here. Just going to increase the depth of this a tiny bit.
Great. Go, 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 go.
So yes, this hurts a little bit more.
Skin feels, what's interesting with the plasma
Yes.
is my
It's
skin
going to
feels
feel
tight.
instantly
Yeah.
because of
Yeah.
the albumin that's present. Albumin is part of your plasma, and it will have like an egg white effect.
Yeah, it
on
is.
here.
It's
Yeah.
like if I think if
So
I
an
smile,
instant
my face
tightening,
would crack.
An instant tightening and lifting effect.
See, that's as much as I can move my mouth.
Okay, so I've taken the smallest needle that we have that we use in premature infants. It's a tiny bit longer.
Premature infants.
Yes.
That sounds
good.
less painful to me. Oh
Okay.
my God, where are
And
we
what
going?
I'm going to
Okay.
do now, okay? I tend to inject for everybody in the traditionally weak areas, which are the nasogenian areas, a little support down here.
Yeah, so I
for
don't get that
everybody.
marionette
Okay,
mouth.
Exactly. Okay. So we're going to try to give a little bit of deeper volume. Now it will look like there's a lot of volume, and I'm putting in, up to several mLs in here. And Trini's going to feel a cool feeling. There's no anesthetic in this. And with my finger, I can feel the volume in there. I'm just massaging it, and the plasma is going to spread out under the skin. Okay?
How long
Yeah.
will this be
The
voluminous?
volumizing effect is usually about, it's variable in the duration because it's going to be more subtle in a couple of days, okay? But you're essentially going to be resorbing the plasma, the vehicle for getting the platelets in, within about 36 to 48 hours, okay? So you have an initial volumizing effect, which is more important, and that people can say, oh, gee, it looks like there's too much in there. But quite honestly, in 48 hours, you're down to a very natural volumizing effect. What we are
And then
hoping
how
is
long,
that your
Diana?
cells are going to be doing work for us for about 3 to 4 weeks, bringing in new fibroblasts, new stem cells, and volumizing the deeper space, which can be subcutaneous fat or the deeper dermis. Okay. So that's how it works, okay? Now, I put some in this hollow up here, okay? And as you can see, there's hardly any bleeding because a very tiny needle.
I didn't
There
feel
should
it,
be
by the
no
way, so I'll just say
bruising,
people.
okay? Yeah.
I didn't.
And I'm going to put a tiny bit here where we're all weak, okay?
Yeah.
In these areas. I also can do the lips with this. I can do many areas, okay? Some people who have had
Could you
allergic
do my lip
reactions.
lines?
Yeah.
Oh, yes,
Yeah.
please.
So all this can be done.
Just going to go really in close there.
So I'm putting quite a bit of volume, and Trini can feel it on the inside. There's a lot going in, but
Yeah,
this
it's
is not
cooling.
going to be visible volume, and it will also, by injecting here, we're going to have an effect of the platelet-rich plasma all through this area.
Oh,
It's
really?
not because I put plasma here in a bolus that I'm not getting a larger area, a radius of effect. So that's why I say you don't have to put it in deep everywhere. I tend to use a bolus to volumize. Another area that I like to use it in is to lift this area, which tends to flatten out as we get older, and we put it under the muscle there.
Okay.
In the eye area, but we're not going to do Trini's because she has a tiny bit of puffiness under the eyes, but under the muscle, So we're getting a lifting of the muscle, and you're never going to have any bluish effect. This is not like filler.
Yeah.
This is your plasma. So
Yeah.
you can't, things can't go wrong with this.
Yeah.
What can go wrong is a bruise, but that's like, you know,
Yeah.
putting a needle in somewhere.
Yeah.
Okay. Right.
Okay.
So I'm going to.
Can you do the lip lines here or not?
I can, yeah.
Yeah,
Now I'm
can
going
you
to
try
do the
that?
whole
Okay,
general
okay,
area.
okay, I've
Okay,
gotta
so we're
breathe in
going. You will see a little bit of volume here because you know your skin. Okay, so I'm putting volume in and I'm directing it towards the lips, and it's very, very. It's not. I'm not doing it like filler, where I would have filled individually this area more superficially. I'm putting it in depth again to build the subcutaneous space up.
Okay.
Because why do you get the lips lines? It's not just from superficial loss of collagen, it's also from the deeper loss of substance.
Okay.
So we're
So that
boosting
general
out.
boosting
Yeah.
underneath, so across,
Yeah.
so you're not individually treating each line.
I don't individually treat
yeah,
the
okay.
line unless the patient is willing to have that sort of treatment, which can be a little bloodier, okay? All right, so you saw that this one bled a tiny bit, so I'm just putting a little more pressure
Yeah, it's
on it,
fine.
okay?
Okay.
But we can do the whole lip line with this if we
Yeah,
want.
yeah.
It's not the same as filler, okay? The lip line is also a little more painful if I'm injecting. I tend to inject up here because you're not going to have pain, all right? If I inject into the lip line, I should have anesthetized the whole area a tiny
Okay.
bit, just so you don't feel it as much, okay? But you'll see a nice reboosting of this subcutaneous space, which we all lose, and then when you purse your lips,
Yeah.
you're going to see many more lines. But it
Okay.
builds up to the subcutaneous space very nicely.
Okay.
All right.
Okay, great.
I think that many people will also do this treatment when they feel generally their skin is looking tired because
Yep.
they know it's going to be a great pick-me-up.
Yep.
If you had a scar, I would put this in the scar, directly in the scar, and then go over
So
it with the
on my neck, you know when I
Yeah.
have my neck
yeah, we're going to put it
injection-
right
yeah.
in there. Yeah,
Yeah, because that's something I had
yeah.
as
So
a
we're going to put
scar,
it
yeah.
right in this scar, and you're going to see that it will fill all the way through. Scar tissue has a big advantage. I hope it's what you're feeling, is that you don't feel it as much
No.
because there's not much nerve endings.
Oh,
And you can
okay.
see it's just spreading right through the scar and lifting it. Okay? So I don't know if you can see that. But we've actually just gone through and tried to lift the whole thing. And there's a little vent area. See, it also helps us to lift any fibrosis that could be pulling down. We're actually breaking it up. And as you can see, that spread because that whole area had not adhered yet
Yeah.
in the scar formation. So it's a very nice for breast scars after breast surgery too. And you can see in one spot I put in more, that's why it's a little bit bumpy, but all that's going to smooth out now with the next treatment we're going to do.
In the right place. So it's all been done, and it feels a little
A little dry.
tight
right?
and
Yeah,
dry,
a little tight.
but
And you can see here that it's looking a little crepey. This is the egg white effect that I was
Okay.
telling you about. This will disappear obviously when we moisturize now, but that little egg white effect is normal. It's the albumin that's giving you an egg white effect.
okay. So if you want natural, self-healing, fillering fantasticness,
15 minutes.
this is probably the best way to get anything to make your face look younger, better, healthier, less lined, fuller, all those things, and it's your own plasma.